Personal problems nurses and other health workers do cope with well on duty. Now, just like we've explained when we were, discussing about the category of people that do come to the hospital, now we equally need to look at what are some of the personal problems that some of the hospitals have do cope with, while still trying to, carry out their official duty. It is equally very important that public and other stakeholders know and understand that despite professionalism, nurses and other health workers are still human beings. They equally have to contend with personal issues and problems of their own, yet they suppress them to care for the patient. Well, it should not serve as excuse for negligence or misconduct. It is necessary for the public and stakeholders to be aware of some of these problems. So what are some of these problems? One, the nurses do face the problem of stress and burnout. High stress environment, heavy workload, and lack of resource can lead to burnout. Almost all our nurses are facing this problem because of heavy workload. You don't have adequate resources to care for a patient. You work under strenuous situation. All these things can lead to stress and burnout. Then the emotional demand of caring for patient and family can be draining. You meet with different kind of patient with different kind of medical or surgical condition. Managing them sometimes do have emotional toll on you. Sometimes when a patient, maybe you'll be managing a patient for almost a week, maybe during your morning shift. Then when you come to evening shift, you suddenly discover that patient is dead, and maybe you think that the patient is improving, and suddenly the patient died. It has emotional, trauma on the patient, whether the nurse or the doctor. We've seen situations where doctors cry or nurses cry when they lose a patient. So all these are emotional drain on the patient, which can lead to burnout. Then compassion fatigue. Repeated exposure to traumatic or distressing situation can lead to compassion fatigue. What do we mean by compassion fatigue? You repeatedly meet with a very bad case that have come up to you. Maybe some of them die, some of them they are still struggling to make it. So in a way, it will bring fatigue to you. So mentally, you are stressed off. Then, because of that emotional fatigue, it will lead to decreased empathy and emotional numbing. You become, your emotion, that is why some people, the public, they say, the health workers or nurses, doctors, they don't have, sometimes when they see people, they don't feel that empathy that is expected of them. It is because of emotional fatigue. You have seen so many bad cases. You have seen so many patients died. So because it has happened on and on, you become emotionally fatigued. So the empathetic nature that's inborn in you will become numb. So you don't feel that serious urge to begin to cry sometime when you see such certain, where people are crying. People will see your eyes just dried up because already it's like you are used to seeing, or this type of cases. Then you have a physical demand. Long hours, physical labor, and exposure to infectious disease can take a toll on physical health, which is all we've been explaining. Then we have musculoskeletal injuries, fatigue, and sleep deprivation are common and can lead to unintended aggressive response to simple demand or questions from patients or their relatives. Sometimes maybe you've handled so many cases you don't have any time to even rest for a few minutes on your own, and then suddenly another fresh patient, another new patient is just coming in. Well, you are at the peak of your stress point. When such patients come to you, at times, if care is not taken, the way you respond to them can lead to attack. The patient will not understand. They are not within the hospital. They will not understand the kind of stress that you have gone through. So you don't expect them to understand you, because they were not there when you are handling 10 to 15 patients all alone. All they care about is for you. They brought their own patient now. You should now, handle their own patient. That is all that matters to them. And if care is not taken and you respond in a very negative way to them, the next thing can, so we should avoid such situation. Emotional labor. Managing emotion to provide empathic care while maintaining professional boundaries can be emotionally draining. Now, it's still the same explanation we gave just now. When you are managing a patient that you are feeling so sorry. Let me use the word so sorry for that patient. Now, at times you may not have the boundary. You don't have the boundary between you are not the one that control your attention, your emotion. Though when it is expected as professional that you should always control the emotion, you are not the one. Sometimes you cannot control those emotions. Now, suppressing emotion can lead to emotional exhaustion. Even when you have been asked to suppress emotion, when you suppress those emotions, it will also have a toll on you. You become exhausted as you are trying to suppress, not to show emotion. It becomes another problem on you. Now, work-life balance. Long hours, rotating shifts, and overtime can disrupt work life. Virtually, nurses, medical doctors, and other health workers, their social life is terrible. Let me put it that way. They now find it very difficult to maintain friendship. They can't, because most of the time when people are there in the town socializing, they are at the place of work due to shift. So all these things, they can lead to emotional trauma that sometimes the way you behave to the patient relative can be very unbecoming. Now, difficulty in maintaining relationship, caring for family members, or pursuing hobbies. At times, they cannot even have time to take care of themselves. All these things, it is important for the public and the stakeholders to be aware of all these type of situations that the nurses and midwife and other healthcare providers do go through in the course of providing medical care to the patient. So, by understanding this thing, at least the health workers will understand that yes, this is the situation that these people are working under, so I should not add to their problem. Then the other one is moral distress. Nurses may be experiencing moral distress when faced with situations that conflict with their personal values or ethics. There are situations, especially among our female colleagues, there are situations that because of certain culture which they come from, there are certain procedures that conflict with their own moral value, but they still have to do it. Now, for instance, a situation where a female nurse is the one in charge of male surgical ward, or even male medical ward, any of the above, male, but she is the one in charge in that shift, and patient is having urinary retention. Now, maybe it has been prescribed that this patient must be catheterized. So imagine her, she probably would feel too awkward, having to put catheter on the private part of a male patient, despite the fact that it is a professional calling. But because she's a cultured girl, she's a cultured individual, she will find that procedure to be very awkward for her. So when she's able to carry out that, she will feel some level of guilt or shame or kind of regret that, she, and male, we found a situation where when a female was trying to catheterize one male patient, on those handling the male private part, this guy got erection, and then she has to, leave that procedure altogether, because as he was trying to put the catheter, the guy was, subconsciously. So she had to run and look for a male individual to come and do that. Then self-care. Nurses often prioritize patients' care over their own self-care. Neglecting self-care can lead to burnout, decreased productivity, and decreased job satisfaction. You see, this is very true. Well, the nurses are always trying to, take care of the patient. They forget to take care of themselves. They are good at taking care of patient, but not themselves. So thereby neglecting their own health. That is why the nurse or any medical staff is one of the most difficult patient to manage, because they neglect their own health. They always come to the hospital when the condition has, really, gone bad. So these are some of the things that the public and then the stakeholders need to take care of, and then try and avoid attacking, or take sympathy on them when they are on duty. Thank you for listening, and I hope you ask questions, share this video as much as you can. Thank you for listening. We've come to the end of this.
Thank you very much, sir, for this wonderful presentation. We pray for more knowledge, more grease to your elbow. Actually, this has been a major challenge to our health workers while working, more especially in this area, northeast section of Nigeria. So, based on this presentation, I can understand that there has been a lot of burnout, because based on the patient, nurse to patient ratio, you can see that most of our nurses, they are taking care of more than 20 patients in a ward. And you can find out that patient in critical condition can be more than 10 sometimes. At least maybe 5, if there are no. Because you can have people with blood transfusion, some of them post-operative, more especially in surgical ward, some of them diabetes in critical condition, and then talk less of when you go to O&G, antenatal maternity complex, you will see a lot of labor, maybe sometimes the whole of the bed, and you will have emergencies and rest. Those are based on this issue, and there is nothing the government can do. We have some agencies, mostly like Ministry of Health, Yopima, and rest. They usually emphasize on the standards, on the standard of work, while the nurses are let out like this. The remuneration sometimes is very little. What would be your advice to both the staff and the government, how to improve the standards of the nursing profession that is based on the part of the remuneration and encourage motivation? So,
thank you very much for this question. Basically, our presentation is preventing workplace violence against nurses. We have talked about the kind of patients or the category of patients that do come to the hospital, the number of patients that the nurses have to deal with, which is very, very much most of the time in most of our hospitals. And then we equally talked about the burnout because of such situation. Now, as a professional, if you are not properly remunerated, despite all this, it will affect your output for sure. So I think what I will advise, one, there are two critical areas that I want to mention. One, there is need for continuous education on the part of the nurses, either the association at the unit level or at the state level or at the national level. I'm calling on them. They should take continuous education of our members very serious. Secondly, on the part of remuneration, apart from the salary, there should be other way which hospitals can, give moral support to the staff under them, such as when there are workshops, the hospital should be able to sponsor some few individuals to go and attend such workshop, because by moving out of the state to go and attend a workshop, it gives them opportunity to at least unwind and then discuss with some of their colleagues from other states. They learn a lot through this process. But a situation where you just allow the nurses for them to fend for themselves in terms of I think they are not giving them the moral support that is expected. If you sponsor 2 in one ward today, you can sponsor another 2 in another ward, like that, just to encourage them. Because at least if not all of them that are going, at least them seeing that some of their colleagues have been sponsored to go and attend some workshop, it will give them hope that maybe it will come to my turn. And hope is what keeps people generally, human being, alive. So it gives them that hope that one day it will be their turn. So I think this is what I'll advise. And the general public too, they should try to understand some of these things that we've mentioned during the last part of our presentation. Nurses and midwives are human beings like you. They have personal problems too, but they suppress their own personal problem to attend to you. So you should try and put that at the back of your mind before attacking them. Sometimes they may behave unprofessionally, but it's not that making it is because of the stress and burnout that they're facing. So I think this will just be my advice. Thank you.
Thank you very much, sir.
Thank you too.